everyone, and welcome to your Electronic Health Records course. Today, we will be discussing Chapter 2, Health Data Structure, Collection, and Standards. Before we get started, let's first go over today's learning objectives. When you finish this chapter, you will be able to describe the roles of 6 healthcare professionals who maintain or use practice management and electronic health record software. You'll be able to explain the difference between data and information, define information governance and the HIM professional's role, identify computer-based health information media, relate how screen-based data collection tools are used in a healthcare setting, demonstrate how individual data are collected, describe electronic health record applications, identify laws, regulations, and standards that govern electronic health information, and distinguish between practice management software and hospital health information software. Next, let's take a look at today's key terms. Starting with American Recovery and Reinvestment Act of 2009, Certification Commission for Health Information Technology, Clinical Decision Support, Data, Health Information Exchange, Health Information Technology for Economic and Clinical Health, Act, Health Insurance Portability and Accountability Act, Healthcare Administrator, Healthcare Systems Administrator, Information, Information Governance, Institute of Medicine, Meaningful Use, Merit-Based Incentive Payment System, National Academics of Sciences, Engineering, and Medicine, the National Academies, Nationwide Health Information Network, National Provider Identifier, Office of the National Coordinator for Health Information Technology, Personal Health Record, Picture Archiving and Communication System, Protected Health Information, Regional Extension Center, Regional Health Information Organization, structured data, and unstructured data. Before we dive into today's lecture, I first want to go over the different medical professions within healthcare. Starting with health information and informatics positions, like registered health administrator, registered health information technician, certified health data analyst, certified in healthcare privacy and security, certified professional in healthcare information and management systems. Next, professions in health information specialty areas, including the AHIMA Certified Healthcare Technology Specialist credentials. Coding professionals include certified coding associate, certified coding specialist, certified coding specialist physician-based, certified professional coder, certified outpatient coder, certified inpatient coder, certified interventional radiology cardiovascular coder, and specialty coding designations. Medical assistant professions include a certified medical assistant and registered medical assistant. And then professions within healthcare that fall under the health administrators include certified healthcare facility manager, fellow of the American College of Healthcare Executives, American College of Medical Practice Executives, certification, certified practice manager, certified medical practice compliance specialist, and certified physician practice manager. Care providers professions include physicians, which include doctors of medicine, doctors of osteopathy, physician assistants, certified registered nurses, midwives, and nursing, including registered nurse and licensed practical nurse. Okay, next, let's talk about the professionals who maintain and use health information. In the inpatient setting, the healthcare administrator may be the chief executive officer, chief operating officer, chief financial officer, and chief information officer. These positions are typically held by individuals who have bachelor's or master's degrees, and it is their duty to oversee several departments, concentrating on the operation of the organization as a whole. A healthcare systems administration is a leadership position that is responsible for the information technology functions in a healthcare facility. This position can also be referred to as the Chief Information Officer, and their main concern is making sure the automated systems in each department are running as they should. People in this position tend to have a great deal of knowledge and experience when it comes to technical aspects of automated systems, so it is no surprise that they are involved in the implementation and maintenance of electronic records. Now, the term data and information are used interchangeably, but it is also important to know that they are not the same. Data refers to a single fact, like a patient's name, temperature reading, or white blood count value, while information refers to raw facts that, when viewed as a whole, have meaning. For example, a care provider collects data such as temperature or white blood count from a patient. When viewed together with the patient's symptoms, the provider can determine a diagnosis, such as appendicitis. Data is so important in the medical field, so it is important that data is accurate, valid, timely, and presented in a usable format. Now, there are two forms of data: unstructured data and structured data. Unstructured data can come in the form of words or an audio file and is written in narrative form, while structured data are presented in a specific format, whether it be numeric, alphabetic, or alphanumeric. Some examples of unstructured data include transcribed, while structured data are presented in a specific format, whether it be numeric, alphabetic, or alphanumeric. Some examples of unstructured data include transcribed reports based on the physician's dictation, voice files, and written progress notes. And some examples of structured data are standard templates that are used to collect the elements of a dictated report or progress report, or numeric codes that equate to a written diagnosis or procedure. Next, let's talk about information governance. Information governance refers to the acceptable protocol and structure of preserving health information. The American Health Information Management Association, or AHIMA, defines information governance as the enterprise-wide framework for managing information through its life cycle and supporting the organization's strategy, operations, regulatory, legal, risk, and environmental requirements. So let's stop and think. How would you summarize information governance in your own words? For me personally, when I think of information governance, I think of making sure that the information of patients and all information collected in the healthcare facility is kept organized, safe, and stored while meeting the regulations and guidelines. Now, healthcare data is used for patient diagnosis, financial reasons, compliance, such as rules, regulations, and standards, quality assessment, risk management, defense of legal interests, and administrative responsibilities. If you are in health information management, where it is your job to be in charge of the data, you are responsible for capturing data, handling data, data storage, ensuring accuracy, timeliness, demonstrating credibility, and enforcing security. In addition to those duties, HIM professionals are also responsible for following the rules surrounding the capture and storage of data from licensing agencies, accrediting agencies, private insurers, government agencies, and internal bylaws or policies. It is also important that HIM professionals analyze health records to ensure rules are followed, ensure that required content is present in electronic health, and perform quantitative and qualitative analysis of the health records and code procedures and diagnosis. HIM professionals are also responsible for the coding of diagnosis and procedures, which allows for the collection of data to be used not only for reimbursement purposes, but also public health initiatives. For example, collecting information on mortality or morbidity on local, national, and global levels. In addition to that, HIM professionals are also responsible for decision-making in healthcare facilities, which consists of allocating resources, purchasing equipment, staffing, and expansion, or reduction of services, And lastly, they are responsible for the reviews of documentation and coding quality should be performed on an ongoing basis. Next, let's talk about computer-based health information media. Before electronic health records, healthcare providers would use paper records to keep track of information. These were kept in folders and filed away by medical record number or alphabetically. Now, in some offices, paper records are still used. However, electronic records have become the norm. As of 2017, the use of EHR is a requirement by the HITECH Act. With this, insurance agencies promote that their patients are able to access their records through PHR, which is personal health records. With this, patients maintain their own personal health records that contains medication, allergies, health history, immunization status, instructions given by providers, and educational materials. It's important to remember that personal health records are not considered legal documents. Computer-based health information media does more than just store data and make it accessible. It also provides physicians with clinical decision support. This allows providers to access current information about conditions and diseases. It alerts providers to possible medication interactions and provides research-based treatment options, as well as alerts providers to possible patient diagnosis based on their EHR records and helps providers to stay up to date on recommended treatment and recent studies. One great thing about technological advancements is that it gives us access to information in different ways. Other types of computer-based health information media include 3D models and drawings, videos for patient education, graphs, or anatomy images to clearly represent the patient's problem, educational materials specific to condition, treatment options, or medications. Other media also includes visual presentations, visual flow sheets to chart trends or statistical changes, speech to text and picture archiving, and communication systems known as PACS for shows allows providers to view images such as x-rays, scans, and ultrasounds. If you are entering data, you will typically do so on a computer screen, whether it be a desktop computer, laptop, notebook computer, or PDA. Think of this screen as the replacement for paper. The advantages of this method is that the information is portable. You have the ability to have multiple monitors with different views at the same time, and you have the ability to customize screens based on the user's preference. Collecting data elements. Now, data collection begins when the patient first reaches out to the provider or facility. So when a patient calls to set up that first appointment, information and data has already started to be collected. Identifying information from the patient or representative can be obtained verbally or by having the patient fill out a form. With information like past medical history, surgical history, social history, and family history being some of the areas the provider will want more information about, as well as a history of present illness. Once the information has been gathered, it is reviewed by the provider, and then the provider makes an assessment of the patient, determining the diagnosis or suspected diagnosis. Then the provider will determine a treatment plan. Previous health records can also be used as a source of data, even if this information was obtained by a different provider. The paper records can be scanned into EHR, and records can electronically be retrieved. Next, let's go over the difference between EHR, which we have been discussing, and EMR, which stands for Electronic Medical Record. According to Garrett Davis, the electronic medical record is a legal patient record that is created within any healthcare facility. This information is related solely to that episode of care, and the EMR is what the EHR uses as its data source. This is in contrast to EHR, which is simply a health record kept in electronic form. Also, healthcare providers, patients, employers, and insurance carriers can access as appropriate and in accordance with HIPAA. Now, what is HIPAA? Let's do a quick refresher. HIPAA stands for the Health Insurance Portability and Accountability Act. It sets up standards for storing, maintaining, and sharing electronic health information and ensures privacy and safety of protected health information. Next, let's talk about another healthcare organization, the Regional Health Information Organization. This includes healthcare organizations in a geographic area that exchange health information. The goal of this organization is to improve patient care, reduce duplication, and reduce unnecessary cost. The Health Information Exchange is a movement that promotes the sharing of information between healthcare entities. It's important that the information sharing must be secure at all times and that they are staying in accordance with nationally recognized standards. In 2003, the Institute of Medicine, which is an independent, nonprofit, and non governmental organization, defined the functions of an electronic health record. This organization works to provide unbiased and authoritative advice to decision maker as the public. Their 8 core functions are electronic communication and connectivity, patient support, administrative processes and reporting, reporting and population health, health information and data, result management, and order management and decision support. Next, let's discuss laws, regulations, and standards, and discuss HIPAA a bit more. The Health Insurance Portability and Accountability Act, also known as HIPAA, was first passed in 1996. It includes regulations to allow people who left their employment to keep their health insurance or obtain new, even with pre-existing conditions. HIPAA also sets standards of storing, maintaining, and sharing electronic health information. And lastly, HIPAA ensures the privacy and security of health information. There are many rules that HIPAA enforces that make sure the patient's information and treatment is handled correctly. We're going to discuss 2 rules, the privacy rule and the security rule. The HIPAA privacy rule ensures privacy of health information, ensures use of protected health information, which is in any piece of information that identifies a patient, including clinical information. The HIPAA privacy rule also makes sure compliance is enforced by the Office of Civil Rights. The privacy rule also protects electronic data collection, maintenance, use, and storage, and makes sure that the practices are meeting the standards. It also enforces that health records are legal documents. The HIPAA security rule requires healthcare organizations to implement safeguards to protect information, such as administrative, physical, and technological. It ensures that information is kept private and ensures that information is retrievable in the event of an EHR being compromised. Next, let's discuss electronic healthcare transaction, code sets, and national identifiers rules. These rules require the medical provider who submit electronic claims comply with regulations requiring standardization of electronic collection and exchange of health information. Hospitals, physicians' offices, and clearinghouses are required to submit claims, including procedure and diagnosis codes, electronically, and they also receive information from insurance companies electronically. On January 1st, 2012, HIPAA version 5010 of the Code Set Rules went into action as a part of the Electronic Transaction Standards of HIPAA. This was an upgrade of the previous version of 4010. This was a necessary change in order to implement the new ICD-PCS code set. These codes vary in length and are alphanumeric. It included improved instructions for the use of the National Provider Identifier, or NPI number. This number was unique to the provider and must be used on insurance claims to identify the care provider or group practice that supplied patient care. The implementation of the National Provider Identifier was the original HIPAA regulations to take effect. Next, let's discuss the Health Information Technology for Economic and Clinical Health Act. This act, also known as the HITECH Act, was a part of the American Recovery and Reinvestment Act and was signed into law by President Obama in 2009. It was an economic stimulus plan that included provisions for the HITECH Act, and its purpose was to increase the use of electronic health records by hospitals and physicians. Now, with this program, there were incentives that physicians and hospitals could benefit from, like the meaningful use stage, which was collection and use of data, the Meaningful Use Stage 2, the secure exchange of information, and the Meaningful Use Stage 3, use of patient data to improve patient outcomes. Okay, next, let's move on to the next federal entity, the Office of the National Coordinator for Health Information Technology. This is the principal federal entity responsible for handling of health information. The National Health Information Network sets the standards for the secure exchange of health information. The current National Health Information Network activities include Nationwide Health Information Network, the National eHealth Collaborative, and the Direct Project and Connect. Okay, everyone, I know we've been going over a lot so far in reference to laws, regulations, and standards. We only have a few more slides to go, so stay with me. Next, let's discuss the Certification Commission for Health Information Technology. This was founded to develop certifying criteria of EHR systems such as functionality, interoperability, and security. The Certification Commission for Health Information Technology ended operations in November of 2014, and after that, it became the ONC's responsibility for certification of electronic health record systems. Next, the Healthcare Information and Management Systems Society focuses on the use of information management systems to improve healthcare. It provides important information regarding the EHR on its website. Lastly, when it comes to laws, regulations, and standards, we'll be discussing the Medicare and Medicaid Electronic Health Record Incentive Programs and the Regional Extension Centers. The Medicare and Medicaid EHR Incentive Program requires the use of certified EHR technology. The Regional Extension Centers, or REC for short, are funded by the federal government. They provide technical assistance and guidance for the selection, implementation, and maintenance of an EHR that satisfies meaningful use requirements. And they are also responsible for a geographic region in the United States. Next, let's change topics and discuss the similarities and differences between a physician's office and hospital information systems. In all healthcare settings, each patient must have a health record. We've already discussed the electronic capturing of data. We've already discussed that the electronic capturing of data is the easiest and most accurate means of maintaining health records. But now let's discuss the difference of how this is done in each setting. In a healthcare setting, captured records are called the master patient or person index. They include part of registration, admission, discharge, and transfer functions of the hospital's automated information system. Each patient is entered only once into the MPI. Separate visits or encounters fall into the main MPI entry for each patient, and incorrect or unreliable data should be revised in the MPI. Practice management or PM software is used to handle office administrative functions. There is a listing of all patients seen in the practice, as well as capturing insurance and demographic information. Practice management or PM software is used to handle office administrative functions. There is a listing of all patients seen in the practice, as well as capturing insurance and demographic information. The patient management software is used for entering charges and diagnosis and procedural codes. PM software is also used for filing, managing, and following up on medical claims and collection, as well as running statistical reports and scheduling appointments. Electronic health records are also used to capture and identify information and clinical documentation. The use of jargon in the medical field is used constantly, and one word you need to make yourself familiar with is SOAP notes. This stands for Subjective, Objective, Assessment, and Plan. It is a format used to document progress notes in any setting, but most often in outpatient settings. The subjective part is the patient's complaint in his or her own words. Next is objective. This is a description of observations or measurable findings. Assessment determines a diagnosis or suspected diagnosis. And lastly, plan is the treatment. SOAP notes in an outpatient setting are similar to progress notes in an inpatient setting. So now let's go over the specific similarities and differences. In an outpatient facility, patients schedule appointments, which is in contrast to hospitals where patients are registered or admitted. Documentation in a physician's office is done in the SOAP note format, while in an inpatient facility, the end product is a health or medical record. Also, in an outpatient facility, patients are registered once in the patient list. Each point of care is called an encounter or visit, and upon visit completion, the patient checks out. And in inpatient or hospital, they operate differently. The patient is listed 1 in the master patient index. Each point of care is called an encounter, and upon visit completion, the patient is discharged. When it comes to implementing practice management or EHR, there are many options available. There is a team of professionals that should investigate the right product for the office or facility. And lastly, it is essential that adherence to standards and regulations be considered when choosing a software, including privacy, confidentiality, and security. That concludes today's lesson. If you have any questions, feel free to reach out to your online instructor.